youth prevention grant, implementing comprehensive suicide prevention programs across the state. RHAU received their Master's of Social Policy from University of Pennsylvania School of Social Policy and Practice, and is an East Coast transplant located in Moab.
Thank you so much for having me. So I just one note I will say is that sometimes when I'm speaking, my eyes just water a lot. So if it looks like I'm crying, I'm fine. Don't worry about it. But sometimes it can look alarming to people. So just to be aware. Let me just share this. Are you seeing my presentation? Oops, no, you're probably not. Sorry.
Looks good, right?
All right. And please let me know if I'm speaking too quickly or anything like that, because I do tend to speak sort of quickly. So today we're just going to sort of generally talk about suicide prevention, the topics that we're going to cover, just generally what suicide prevention in Utah looks like, a little bit of safe messaging, so how we talk about suicide, the risk and protective factor model, which is sort of the primary way that, especially in Utah, we think about suicide prevention, warning signs for suicide, a little bit about means safety and crisis intervention, and then some local and state resources. So a little bit of everything. Just a little bit about me and where I'm coming from. I'm non-binary / transgender. So I use they, them pronouns. I'm someone who has lived experience with suicidality and mental illness. And my areas of sort of interest are rural mental health, crafting as suicide prevention, and healthcare for LGBTQ+ people. All right, so a little bit about suicide prevention in Utah, some data. Usually we are in the top 10 of states for highest suicide rates. So we fell out of that place in, I think, 2021. But as you can sort of see, there's what people might call the suicide belt. So we're pretty similar to states in the Intermountain West. And we, tend to be sort of switching around with them in that sort of area. So we also like to think about suicide as a lifespan issue. We talk a lot about youth suicide, and that's, the area that I'm focused on, but we actually see a lot more suicide later in life. And as you can see here, this is also broken down by male versus female. So traditionally, men die by suicide more often, and women generally tend to attempt suicide but may not die, which is basically related to this type of means that someone might use when they are attempting suicide. But when we do hear that suicide is like the #1 cause of death for youth, that's like a very scary statistic. And it seems like, oh my gosh, like all of these youth are dying. And it is something that we want to address. And, we don't want any suicide deaths. But young people don't die of that many things, right? Like they're not dying of heart disease, cancer, like these sort of things that we might see sort of competing for like the most prevalent cause of death for older people. And so it often sounds more alarming than it is, that it's epidemic. And, I really don't want to have anyone in our community, but youth think like, oh man, like everyone is just dying by suicide. I mean, that's really scary. So it is fairly rare for young people. And really our primary, most at risk are older males. And then we can see there's definitely a difference between like some differences between areas that are rural versus non-rural. So our non-core, non-metro, so that would be, you can see the over here, so like Beaver, Daggett, Duchesne, Emory, Garfield, Grand, Kane, San Pete, Sevier, Millard, Paiute, Rich, San Juan, Wayne. Those are our areas of the state that have the highest rates of suicide. And then, as I said, the means of suicide, so why do men die more often? It's because they often choose firearms. There is a little bit more of an evening out more recently in terms of, um, you know, women also dying by suicide, not in like a positive way. So, but in Utah, almost all firearm deaths are suicides. So there is a misconception that, having a firearm in your home will keep you safe, but it most often will hurt someone in your own family. Just statistically, it's more likely to be used in a suicide than in, home invasion or that sort of thing, and another type of crime. All right, so in Utah, we have a sort of unique structure compared to other states. The sort of official teams that work on suicide prevention for the state are my office, the Office of Substance Use and Mental Health. We also have the Office of the Medical Examiner, which is unique. Most states don't have a state level medical examiner. So this helps us do like a lot of studies across the state of deaths and understanding like what our suicide trends are, which is pretty cool. Our local mental health authorities and our local health district. We have the Utah Suicide Prevention Coalition, and also there are local prevention coalitions. And so what do we do on this team of people? So we identify gaps and resources needed to improve sort of infrastructure for suicide prevention in the states. Sometimes that's saying, hey, people, these clinicians maybe need some training related to how to work with patients who are, experiencing suicidal thoughts or, any sort of suicidal behaviors. Or it might be some other types of social um, supports that need to be put in place. We work with trying to make partners across the state. We're very focused on this coalition model and having really diverse partners from, people you would expect, like Intermountain Healthcare, but also the National Shooting Sports Council and some firearm sort of advocacy groups. So we really try and be diverse in the partners that we have in the state. And then this is just a little bit, if you're interested, about the Utah Suicide Prevention Coalition. It was founded in 2012. We have meetings, I believe, quarterly. If you're interested, I can provide the information. We have like open meetings that have usually training of some kind or information about something that's going on in suicide prevention in Utah. And then within that, we also have a variety of work groups that focus on specific aspects of suicide prevention in the state. All right, so the purpose of we have a suicide prevention coalition and plan that goes along with it. And so the purpose of this is to provide guidance to the Utah Suicide Prevention Coalition, guidance to community partners and local communities that are trying to say like, hey, how can we do suicide prevention in our area? We work with legislators to help them understand what legislatively would be best for suicide prevention in the state. We keep up to date on data and also like provide information about how to interpret that data and just provide a basic understanding of Utah suicide prevention structure, our goals, and how we're trying to get there. And so these are some of the core strategies of our most recent suicide prevention plan. We redo the plan every 5 years. So this most recent one will go through 2026. And something that I think is really cool that we've added to this most recent one is strengthening economic support. So I think often, we think public health is not necessarily like economic support. But really what I love about Utah suicide prevention is just a very open idea of what we need to do in order to address our suicide rates. Um, any questions on like general suicide prevention? A little about safe messaging. So when we talk about suicide, there's some language that we typically use, and sometimes that language is less than helpful, I guess. So, I think the most common thing we hear is, someone committed suicide. And we're really trying to move away from that, especially in the field of suicide prevention, because that word committed makes it feel like it's a crime or a sin, right? Like that's what the other way that we use the word committed. And so you might notice that I always say that someone died by suicide. And that's typically what we say in lieu of this. You might also hear successful suicide or completed suicide, which, we don't want to imply that suicide is like something you're checking off your to-do list. Like you did it, you completed it, it's good. Likewise, an unsuccessful suicide or a failed suicide, you don't want to sort of be putting on like, oh, this person like couldn't even succeed at this thing, right? So it's really small things, but it can change the way that we are thinking about and talking about suicide. So we might want to say instead that someone survived their attempt, or is a suicide survivor. Then this last one, so instead of saying Sally is suicidal, just sort of expanding that to say that Sally has or had suicidal thoughts or behaviors, just to understand that Sally is more than just her, suicidal behaviors that may exist. Okay. So some messages that are unsafe, and we might see these in the news or the way that we report about suicide, especially. So if we have repeated, prominent, or like sensational coverage, details about suicide method or location, glamorizing or romanticizing suicide, portraying it as a common thing or an acceptable way to deal with a problem. Sort of saying that there's just one cause for someone's suicide death. So suicide's very complex. We don't want to, make people think like, oh, well, the only reason that they died by suicide is because they lost a job. It's usually a lot of things. When we include personal details that encourage identification with the person who died, that can lead to copycat suicides or sort of a contagion effect. And then negative stereotypes of people with mental illness that reinforce stigma. So implying that people with mental illness are dangerous to others, that sort of thing. And I will say that looking at this list, it is pretty much a lot of what happened with, and this was, 10 years ago, but when Robin Williams died by suicide, the reporting was pretty sensational. It was very explicit about means, like exactly how he died, pretty graphic. And we did see an increase in suicide deaths with men who sort of identified with him after that. So we can see that this sort of reporting can have a negative impact on suicide deaths. On the other side, we can have messages that help. So, providing resources where people can find treatment, advice that promotes help seeking, the idea that treatment works, that, you're not alone, we're here to support you. Positive social norms. So the idea that most people with thoughts of suicide recover and they continue living full and, fulfilling lives. Suicide is preventable. It's a very preventable cause of death. Um, it's great to have stories of lived experience for those who overcame a suicidal crisis. I will say that often, if you know someone who does have lived experience, and wants to share that story, there are resources to help you tell that story in a safe way. So the American Foundation for Suicide Prevention, AFSP, has like a training for people with lived experience who want to share their story. The idea that seeking help is a sign of strength and that suicide is not a natural or logical outcome of adversity. So some other ideas about promoting this narrative of hope. There's an idea that talking about suicide will make someone attempt suicide. And the research really does not show that that's true. Oftentimes, when you do talk to someone about, saying like, are you thinking of killing yourself, or having a really frank conversation about suicide, actually can decrease their stress, anxiety, and like those sort of feelings of wanting to attempt suicide, because of it's like a release, right? To have someone else there with you. The idea that depression, anxiety, mental illnesses are treatable and they do not inherently make someone weak. And people, especially young people who are thinking about suicide, typically show warning signs, and we always want to take these seriously. So sometimes I think especially young people might sort of casually say like, oh my God, like I failed this test, I'm going to kill myself, right? Something sort of like hyperbolic. And we might say, hey, they're just being dramatic, right? They're just being a teen. That's just how they talk. But we really want to create a culture where whenever anyone says something like this, we show that we will take it seriously, right? Like if you say that, then I'm going to check in with you and see, are you doing okay? Is there something going on? And maybe they say, no, I'm fine. Sorry. Like I'm just stressed about the fact that I failed this test. So I'd rather people be, overly cautious when we think we might see warning signs, rather than holding back and saying, I don't want to ask, just in case. All right, so the risk and protective factor model, this is sort of our circles of suicide prevention, and different sort of realms where we can have impact on people. So sort of going from the most sort of general macro level down to a person's problem solving, emotional regulation abilities, down at the bottom, the individual. So sort of a community to family to self. So the risk factors for suicide over a lifetime are health. So people often mental health conditions, traumatic brain injuries, chronic pain, other types of terminal illnesses can have someone be at a higher risk for suicide. Environmental, so if there's a family history of suicide, if there have been a lot of suicides in the area that have been highly publicized, then there's, especially for young people, a possibility for contagion, which is when one suicide happens and then we see several more happen, sort of in a cluster. Having access to lethal means like firearms or medications, cultural attitudes about suicide, and about mental health care, and having access to health care. And then life experiences. So this is, maybe like our ACEs. So what kind of abuse, trauma, loss, discrimination. So like minority stress can be a contributor, rejection, and also like having familiarity with lethal means. So if you, are very familiar with firearms, then that doesn't mean that you're going to die by suicide with a firearm. It just means that there might be a risk that you are more likely than someone else who has no familiarity with a firearm to attempt suicide. But like I said, it's a whole host of things, right? Like you could have something that I would say is a risk for suicide in all of these sort of domains. And that still doesn't mean that you're definitely going to attempt suicide, right? It's just like a helpful framework to think about who might be at risk. So breaking this down into risk and protective factors, and these are often shared with substance use substance use disorder, that sort of thing. So feeling isolated or alone, not having access to healthcare, if you have difficulty adjusting to change, um, unhealthy habits or substance misuse, access to medications or lethal means, being in physical or psychological pain, and previous suicide attempts. But on the other side, we have things that protect. So connectedness on a personal, family, community level, and especially for young people, having one trusted adult in your life, not necessarily a parent, but some trusted adult, can go a really long way to counteract the risk factors. Um, Having access to effective behavioral health care, having problem-solving skills, some distress tolerance skills, healthy habits, having a sense of purpose, accomplishment, um, safe environments, and having sort of mental flexibility and physical. So some warning signs that we might see or hear. Sometimes people are very explicit with their warning signs. They might say out loud things like, my family would be better off without me. Um, I just make things worse for everybody. I'm, you don't have to worry about me. I figured out a solution. That sort of thing. Sort of talking about themselves as a burden might be a warning sign that someone is thinking about suicide. And then some things that you might see, behaving recklessly, saying goodbyes, tying up loose ends, um, an increase in alcohol or drug use, changes in sleeping, withdrawing from social life, sudden unexplained or calm or uplifted mood. So oftentimes when people have decided that they, want to attempt, that they're going to attempt suicide, they may feel as though, okay, I have a solution, and there is, in their minds, an end to the pain. So there may be sort of an uplifted mood. Um, Not that we want to question when someone who has been experiencing, sort of depression or, a lot of acute suicidal behaviors, if they're very happy, we don't want to say like, oh, this is just because like you're going to attempt suicide, but just to be aware that it can also look like that. Giving away pets or possessions. And actually, when I started this job, I didn't know a lot about suicide prevention. But over the years, I remember learning that, we wanted to do training with um, people who work at animal shelters, because oftentimes when someone has a pet, they will bring their pet to the shelter before they attempt suicide. So knowing the warning signs for that is, can help maybe identify um, someone who's at risk. And then seeking or researching methods of suicide. So acquiring a firearm, um, especially if that is uncharacteristic behavior, right? So if someone is totally changing the way that they are acting, they've never had a firearm, and now all of a sudden they're like obsessed with getting a firearm, or someone who was very religious is now not religious at all, or the other way around. So looking at changes in behavior in any way can help us just say, hey, something's like off here, right? All right, so some strategies to make the environment safe for someone who may be at risk for suicide. We always want to try, when possible and when it's safe, to involve family members, social supports in making the environment safer. Um, and it's great if you can temporarily remove dangerous medications and firearms from the home, even if they weren't involved in the person's suicide plan. So a little bit more about mean safety. When we talk about mean safety, we want to put time and distance between a suicidal person and a gun, or any sort of means, really. So sometimes we hear, won't they just like substitute something else? They'll just find something else. And some people might, but pretty much anything other than a firearm is less likely to result in a death. It's just the most fatal way to attempt suicide. You also might, delay someone's attempt by limiting their access to a firearm. And having that time can give you some more space to, address the suicidal crisis. So suicidal crises are often brief. The deadliness of an attempt depends in part on the method used. Like I said, firearms are very fatal. And 90% of those who attempt suicide and survive don't go on to kill themselves. So some research was done to say that, so for people who were admitted to a hospital after a suicide attempt, were asked how long they'd been thinking about suicide before the attempt. And almost 50% said 10 minutes or less was how long from the minute they started thinking about suicide to the minute that they attempted suicide. That's a really short period of time. Obviously, there are often like longer term problems that are existing. But the idea of moving from the ideation to the action is often pretty quick. And so if we can put some space, some time in there, some distance between them and this most lethal form of means, then we're going to have a good chance of intervening and hopefully stopping a suicide attempt. All right, any questions on like mean safety or anything like that? Okay. All right. So a little about crisis intervention. And this is obviously tiny and I can send it out afterwards, but this is just a resource that gives information about different crisis services that exist in the state. And I think this is also helpful thinking about the different sort of levels of uh, crisis services. So, we have the Utah Crisis Line, which is now 988. And then we might have a mobile crisis outreach team. So if, someone seems to be at a higher risk than what someone at the crisis line can address, they might, deploy a mobile crisis outreach team if they're available in your area, which they are in most places. We have stabilization services. There are some receiving centers, most of them are north, but we're working to get some more receiving centers, which is kind of like an emergency department for people with mental health concerns. So instead of just going to the emergency department where staff may not have training about how to work with someone who has mental illness or like is experiencing some sort of suicidal crisis, sometimes that can be a traumatic event to go to the emergency department. And so having these receiving centers is hopefully a way to sort of divert people away from the possibility of having a bad experience at the emergency department. And also to connect them better with like, other mental health resources. And then the highest level is, emergency department, inpatient hospitalization, and sometimes jail. So just a whole, continuum of different types of crisis services that might exist. So some resources for clients that I wanted to just make sure you're aware of. 988 is our crisis line. If you have a non-Utah area code, it will automatically route you to the crisis line in the area code that you're calling from. And so like I have an area code from Buffalo, New York. That's not very helpful for me if I was having a suicidal crisis here in Utah, right? And so if that is something, if you're working with like a client or something who is not originally from Utah or didn't get their phone in Utah, you can also call this local number, which will just route you to the Utah crisis line. They're working on doing sort of like how when you call 911, it geo locate routes you to the closest like 911 dispatch. The concern is about privacy and not having a specific location known when you call 988. So the privacy of and sort of confidentiality that when you're calling, it will be anonymous and you won't be able to pinpoint like exactly where someone is, because that is sometimes a concern. So um, the 988 federally is working on a way to sort of fix this geo routing problem. But in the meantime, it's good to know that there's just a line you can call. And there's also specific lines for veterans, Spanish speakers, and then the Trevor Project runs the LGBTQ plus lifeline. And Trevor Project is primarily a youth serving LGBTQ plus organization, focusing on mental health for young people, but this can, the LGBTQ plus lifeline is for all ages. So sometimes it's helpful for clients to know like what happens if I call. So a crisis worker answers the call. They, attempt stabilization for all crises and provide resources. But they can also, the crisis line worker can also directly refer to a mobile crisis outreach team in all counties or receiving center if they exist. So if the person on the crisis line says, I think that this person is at a higher risk than I can, work with on the phone, then they may say, I think that we should involve a mobile crisis outreach team, which, involves people who are trained to deal with mental health crises. There's also the Utah Warn Line. So this is sort of a step below having like being in crisis. So if you're just, feeling lonely or need some sort of support or want some resources, you can call the Warm Line and they will give you just some sort of step down support. And then there are local substance use and mental health services across the state and the different mental health authorities. Like I said, Trevor Lifeline or Trevor Project Lifeline and stabilization and mobile response lines. And then in Utah, we have Safe UT. So there's one, it's an app for reporting like tips about maybe someone who might be at risk for suicide, or if you need help or your child needs help. So it's for students, educators, and parents. But we've also expanded this to have one for first responders who might be in crisis, and also for National Guard members and their families. And then these are just some other helpful apps. I really like the Not Okay one. So I think especially for when people have trouble reaching out and asking for help, if they're sort of like in crisis, sometimes it's hard to like, what would I even say to someone? Just like, I feel really terrible. I don't know. So there's this app that just helps. It will send a message if you say like, okay, I need help right now. It'll send a message to folks that you have already like have already asked to be your support person. So it will just send out a message that's like, hey, I'm not doing okay, without you having to like be the one to do that. So I think sometimes we might have some sort of decision paralysis when we're in a mental health crisis, and this can maybe help a little bit. A little bit about behavioral health navigation from Intermountain. These are some other resources in the state. And so if you are in need of, or if there's anyone that you know of that has firearms and would like to have them safely stored, we at the state always have gun locks. I have a lot down here in Moab, and I'm happy to travel to bring them if you want like a bunch to hand out to people at your organization, to clients, that sort of thing. Occasionally we have programs where we provide funding to get a gun safe, or may also like provide medication lock boxes. And then there is also a voluntary firearms restriction law here in Utah. So you can voluntarily put yourself on a list if you feel like, oh, I'm going to, I don't want to be in crisis and then, purchase a firearm very easily. You can ask someone, you can be put on the list to not be able to purchase a firearm. And you can also request early removal. So there's some more information about it if you are interested. In Utah also, it's not always, doesn't always work in practice, but in theory, you should be able to temporarily give your firearms to local law enforcement to hold for a period of time. Not all law enforcement agencies are like prepared to do this, but legally it is, you can do that. And legally you can ask a friend to hold your firearm for a period of time if you feel like it's not safe for you to have it. So it's important to know we don't want to like take firearms away from people, but sometimes we might need to sort of help protect ourselves, right? And also someone in the chat said that Southeast health department has gun locks as well. And I'm pretty sure San Juan has a bunch. So, but if you need them, we will give them to you. I have a ton in my garage right now. So, all right. Any more questions about mean safety or anything like that?
Can you talk a little bit more about the Intermountain Behavioral Health Navigation Services? And are those available throughout the state?
Um, they should be, but I believe that they're mostly focused on Intermountain like network locations. Um, like I don't know that the University of Utah Health Services would be included in that. So I can get more information about it and send it out afterwards.
Yeah, I love more information about that. Thanks.
Mhm. Okay. And then I did want to touch on a really great thing that we have here in Utah called the Live On Playbook. So we, at the state level, created a course that is pretty easily digestible. It's good for anyone in the community, and not just for Utahns, but like across, it's pretty generalizable to anyone across the state. And we have, it's 10 lessons, which are 10 minutes or less. Right now, you can access it on Live On Utah, at Live On Utah on Instagram. So you can do the whole thing on Instagram, but we're also working on getting the whole thing up on the Live On Utah website. So these are some of the basic things that we talk about. A lot of what we talked about here today, but just sort of like general information so people might feel a little bit more comfortable if someone in their life might be in crisis. Hopefully gonna play this. Is the audio playing at all?
I don't hear the audio on this side.
Okay. Oops, sorry, not that one. sorry, just. Okay.
91% of Utahns report that they've been impacted by suicide,
Are we hearing sound or no? Okay, cool.
which means that 100% of us should know how to help. We believe that everyone has the power to prevent suicide, including you. We've collaborated with experts to create the world's first ever suicide prevention course taught entirely over Instagram. In just a few minutes per lesson, you'll learn the skills that could help you save a life. To enroll, follow us on Instagram at LiveOnUtah. Lessons begin this September.
So
91%.
as a part of this, we also have a Spanish language one that we worked with native speakers. It's not just like one for one translated, so it's more culturally sensitive. And we also just released a version for veterans. So this is very hopefully accessible for people, easy to sort of like jump in, jump out if you like want to do a little bit. It's pretty easy, takes less than an hour to finish it. And you can get a certificate if you'd like to be a suicide prevention ambassador, if that's appealing to you. But just wanted to bring your attention to this because I think it's a great thing to share with, especially family members of people who might be at risk for suicide. And then a little bit about other training that is available. Counseling on access to lethal means, which is, it covers how to talk with your clients or patients about their access to lethal means and have an actual plan for like, can we store this more safely? Can we store your, ammo separate from your firearm? Can we have things locked up in a way that is collaborative? And then and that's a free training that's available online. We also have CAMS, which is Collaborative Assessment and Management of Suicidality. And we also have free, like we can provide you a license to do that for free here in Utah. So definitely, I think some great places to get more specific clinical information about how to work with people who might be at risk for suicide. And then there's also crisis response planning, which was developed for veteran population, but is useful across the board. So it's really, I would say, a very tiny safety plan, if you know what a safety plan is. It's what to do if you're in crisis. And they always do it on this index card because they want you to be something that you have, that you keep. So like at the top, this where it says like crying, wanting to hit things, getting angry. These are like signs, right, that you might be in crisis. The second section are some coping skills, some things to do maybe when you're in crisis. The next section, explicitly who you would contact if you were in crisis. So not just say like, oh, call like my friend. Say like, I will talk to Bill specifically. Includes reasons to live. And then on the back, just some more, in-depth information. So we also provide training semi-regularly throughout the year if learning more about crisis response planning is something you are interested in. And then there's just obviously so much to learn about suicide prevention. I hopefully just gave a very brief overview of a lot of what is out there. But if you have something specific populations, these are some resources. The Mountain Plains Mental Health Technology Transfer Center, which is a mouthful, but they have great webinars and they specifically serve Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. Indian Health Services has information about suicide prevention as well. And then if you have anything specific that you have questions about, want training about, you contact me, and I can get you in contact with someone at the state or elsewhere, or my colleague Alyssa Mitchell. She oversees our clinical suicide prevention, so the trainings, that sort of thing. And then Carol Riddell, who oversees sort of general suicide prevention. So yeah, so that is that. Are there any questions, I guess, or feedback? We have about 10 minutes.
Hi, Ray, this is Cherry. Are we able to get a copy of the slides or all that information that you shared with resources and all those things?
Yep, definitely.
Perfect. Thank you very much. It was great.
Great, thank you. I also do have for those of you who are in Southeast Utah, I have a specific like crisis resources that is for Southeast Utah. But if you're in another part of the state, I can also make one that's tailored to your area. So it includes like more local organizations that can help people in your area.
That would be great to get at the Moab Free Health Clinic, a list of resources.
Okay, yeah, I can send that to you too.
We also have a database that is separated by counties that we could add these resources to also. So we'd really like to do
Cool.
that.
Yeah, awesome. I would love to.
Very, very great presentation. Thank you. Yeah. Are there any other questions? I'll go ahead and stop the recording.